Hello everyone, my name is Dr. Bharat Vyas. I'm a senior consultant physician and specialist in cardiology and diabetology. So we have certain questions from our journalist friends which we'll try to answer in this video.
Okay, the first question, Doc, is how is diabetes contributing to the rising cases of heart diseases you are seeing today?
So diabetes is one of the most commonly identified risk factors for the development of ischemic heart disease. By ischemic heart disease, what we mean is that the coronary vasculature, the coronary arteries which supply the myocardium of the heart, they get blocked because of the development of what is called atherosclerosis. Atherosclerosis is nothing but the deposition of the fat on the surface of the interior surface of the coronary arteries. In people who are diabetic and in whom the diabetes is not controlled well, it leads to a state of constant systemic inflammation or continuous systemic inflammation, and this increased inflammation in the body will contribute to the accelerated development of atherosclerosis. And when this atherosclerosis happens too much, there is formation of what is called atheroma. Atheromas are the buildup of the fat inside the blood vessels. Especially when this happens in the heart, the atheromas may block the blood circulation by the coronary arteries to the myocardium of the heart, which ultimately leads to coronary artery disease. And second thing is that in people who are diabetic, this atheroma development and development of coronary artery disease, that is blockage of the coronary arteries by the atheromas, it most of the time goes unnoticed. One more thing is that when compared to people who are non-diabetic, the symptoms are also milder in diabetic patients. The symptoms get masked. So many diabetic people we see having silent heart attacks which were not diagnosed, and this ultimately leads to heart failure.
Okay.
And in uncontrolled diabetics, the disease also is very diffuse, which means there are multiple blockages which happen inside the heart, and the lesions are also very complex. So doing interventions like stenting these vessels many a times becomes difficult, and we have to subject the patient to bypass heart surgeries. And as we are seeing in Kenya nowadays, the what you call incidence of diabetes is rising, so thereby increasing the risk for coronary artery disease and thereby leading to cardiac mortality. Okay. What is the second question?
The second question is, what are the early warning signs of diabetes people should watch for, and when should they seek medical screening?
So early warning signs of diabetes are either increased, that is rapid gain of weight, or rapid loss of weight. Both can point to diabetes. Diabetes in the early stages leads to gaining of weight, rapid gaining of weight. And in the late stages in the sense when the sugars are very high, when the HbA1c value goes beyond 9, people start losing weight very drastically. That is one of the most commonly missed symptom which people don't seek medical attention for. The most obvious other symptoms are increased thirst. Patient is very thirsty and patient will be drinking lot of water. No matter how much water he or she drinks, the thirst doesn't get satisfied. This is one of the hallmarks of diabetes. People also will be peeing a lot, as I told you, along with thirst, and people may develop burning sensation while passing urine. People can have frequent urinary tract infections. Especially in males, the tip of the penis can get infected and it can present as balanoposthitis, which are the most commonly missed symptom of diabetes. One more thing is that people will also be developing something called polyphagia. People will be very, very hungry. No matter how much they eat, they don't get satisfied. So these are all the most common symptoms of early symptoms of diabetes.
Okay. The next question, Doc, is from a medical perspective, how important is lifestyle modification in preventing heart complication linked to diabetes?
Yes, this is a very important question. So controlling diabetes is very, very important. When diabetes is recognized early, especially people who are newly diagnosed diabetic patients, we can actually postpone the starting the medical treatment for a pretty long time if they follow the lifestyle modifications. And we have done this in many patients. In the early stages when the diabetes is diagnosed, if we alter the lifestyle of the patient, by altering the lifestyle, making the patient to eat healthy, avoid all processed foods, cutting down the sugars completely from the food habits of the patient, asking the patient to follow a strict regimental lifestyle, that is doing exercise every day, also raising up on time, sleeping on time, not taking any stress. By taking all these healthy measures, it is possible to avoid medical treatment for a pretty long time. Even in people who are diagnosed diabetics and suffered from diabetes for a long time, in some people in whom there are no complications, it is possible to avoid the burden of taking medicines every day. But unfortunately, people come very late to us, and we are forced to give medicines to the patients.
Okay, that was very helpful. The last question is, what policy or healthcare system gaps must be addressed to improve early diagnosis and management of diabetes?
So when it comes to the policy, especially the government health policies, first of all, people should be made aware of the complications and the health burden that is caused by this the diseases like diabetes and hypertension, because these are mostly lifestyle related diseases. This is the bane of development, by which what I mean is that societies in which the socio-economic standards, when they improve, when developing societies become middle income societies, the onset of non-communicable diseases such as diabetes explodes. One of the best examples is what is happening in India. India is known as the diabetic capital of the world. This is because of the development that has happened. As countries grow, the non-communicable diseases, they increase in incidence when compared to the communicable diseases, that is infectious diseases. So making people aware of the risk of non-communicable diseases is the most important thing government should think about when planning the healthcare initiatives. One of the most important things the government can do, but I don't know how much it is possible, is making the people aware of, especially when I speak in terms of Kenya, the soft drinks, the sodas, which most of the Kenyan people, which I have seen in my experience, most of the Kenyan people, they consume at least one soda per day. By making the people aware of the risks associated with this kind of processed foods and high sugar diets, we can eliminate the possibility of non-communicable disease pandemic which is happening worldwide. Unfortunately, because these are associated with corporate interests, it is very difficult to do. But people like me, we always, in most of my healthcare awareness lectures, I always tell people about the bad effects of consuming foods like sodas, which contain very high sugars. And also one more thing I am observing nowadays is that the obesity epidemic is happening in Kenya. Many people are becoming obese because our jobs have become desk-based jobs mostly. Okay? So by conducting frequent health camps and health awareness talks by experts, the governments can tailor their policies so as to avoid these burdens of non-communicable diseases.
Okay.
Yeah.
Thank you, Doc. That was...
So that was on diabetes today?
Yes, that was all for today about diabetes. Thank you so much.